In this video, you will learn about the structures of the eye and their functions. We'll explore how the different layers, cavities, and accessory structures of the eye work together to make vision possible. The wall of the eye is made up of three main layers called tunics. These are the fibrous layer, the vascular layer, and the neural layer. The fibrous tunic is the tough outermost part of the eye. It includes the sclera and the cornea. The sclera, also known as the white of the eye, is made of dense connective tissue. It gives the eye its shape and provides attachment points for the muscles that move the eye. The cornea is the clear front part of the eye. It's made of collagen fibers arranged in a precise pattern that allows light to pass through. The cornea bends or refracts most of the light that enters the eye, helping to focus an image. The middle layer is the vascular tunic. It contains many blood vessels and includes the choroid, ciliary body, and iris. The choroid is located deep to the sclera toward the back of the eye. It contains pigment that prevents light from reflecting inside the eye, which would blur an image. Blood vessels in the choroid also provide nutrients to the retina. The ciliary body connects the choroid to the iris. It contains smooth muscle called the ciliary muscle, which is attached to the lens by suspensory ligaments. When the ciliary muscle contracts, it changes the shape of the lens to focus light. The space anterior to the lens is known as the anterior cavity. The ciliary body produces a fluid called aqueous humor, which fills the anterior cavity and provides nutrients to the cornea and lens. The iris is the colored part of the eye. It's made of smooth muscle that controls the size of the pupil, the opening that lets light enter the eye. Circular muscles of the iris constrict the pupil when stimulated by the parasympathetic system. Radial muscles dilate the pupil when stimulated by the sympathetic system. The innermost layer of the eye is the neural tunic or retina, where an image is actually formed. The outermost part of the retina is the pigmented epithelium. These cells contain melanin that absorbs stray light and prevents reflection. Just beneath that is the photoreceptor layer, which contains the rods and cones that detect light. Photoreceptors release neurotransmitters to communicate with bipolar cells, the neurons in the next layer. Then the bipolar cells release neurotransmitters to communicate with the ganglion cells in the deepest layer of the retina. These retinal ganglion cells are the neurons that have their axons in the optic nerves and carry information from the eye to the brain. A region called the macula has a high density of photoreceptors. At the center of the macula is the fovea centralis, a tiny pit with the greatest number of cone cells. This is the point of sharpest vision and color detection. The optic disc is where the axons of retinal ganglion cells leave the eye to form the optic nerve. Because there are no photoreceptors in this region, it creates a natural blind spot in our vision. Inside the eye are two main cavities. The anterior cavity is located in front of the lens and is filled with aqueous humor. This fluid helps nourish the cornea and the lens. The posterior cavity lies behind the lens and is filled with a jelly-like substance called vitreous humor. This helps keep the retina pressed against the choroid, maintaining the shape of the eye. The lens itself is a clear, flexible structure that focuses light onto the retina. When the ciliary muscles contract, they release tension on the ligaments holding the lens. The lens then becomes more curved, bending light more sharply for close vision. This process is called near-point accommodation. As we age, the lens becomes less flexible. This condition, called presbyopia, makes it harder to focus on nearby objects. Now let's look at the accessory structures of the eye. The eyelids, also called the palpebrae, protect the surface of the eye and spread tears across it when you blink. Two skeletal muscles control eyelid movement, while the levator palpebrae superioris lifts the upper eyelid to open the eye, or bicularis oculi closes the eyelids. The conjunctiva is a thin mucous membrane that lines the inside of the eyelids and covers the front of the sclera. It contains mucus-secreting goblet cells and immune cells that help prevent infection. Inflammation of this membrane is known as conjunctivitis, or pink eye. The lacrimal gland, located on the upper outer side of the eye, produces tears. Tears flow across the eye and drain through small openings called lacrimal puncta on the inner corners of the eyelids. They pass into the lacrimal canaliculi, then into the lacrimal sac, and finally drain through the nasolacrimal duct into the nasal cavity. The eye also has 6 extrinsic or extraocular muscles that move it in different directions. The superior rectus moves the eye upward. The inferior rectus moves it downward. The medial rectus turns the eye toward the midline. The lateral rectus turns it away from the midline. The superior oblique moves the eye downward and away from the midline, and the inferior oblique moves it upward and away from the midline. Most of these muscles are controlled by the oculomotor nerve. However, the trochlear nerve controls the superior oblique, and the abducens nerve controls the lateral rectus. If these muscles are weak or if the nerves that control them are damaged, the eyes may not align properly. This condition is called strabismus. In some children with strabismus, an eye patch may be used as part of therapy to strengthen the weaker eye. By covering the stronger eye, the brain is encouraged to rely on the misaligned eye, which helps improve its coordination and visual acuity over time. This approach can be especially effective when started early in childhood, while the visual system is still developing. However, in cases where muscle imbalance or nerve dysfunction is more severe, surgical correction of the extraocular muscles may be necessary to properly align the eyes and restore coordinated vision. Together, these structures protect the eye and allow it to focus light, forming clear images that are relayed into the brain, producing vision. In my view, the eye really is one of our most fascinating organs.